Hey, everybody, this is Debbie Deno, and I want to thank you so much for joining us in this program, getting the most out of your care. And that's our goal, our hope for you during this program. But let's get started. So I'm going to go ahead and share my screen. And oops, there we are. Get this rolling. Okay. So again, thank you. My name is Dr. Debbie Deno, and I'll tell you a little bit more about me and why I got this started. My company's name is Path to Heal. So why did we create this? Well, we're going to go over why we created it, what this program covers, and how to navigate through the lessons. So first off, again, my name. Kind of my health journey. I started off as a massage therapist and going to chiropractic school in the 1980s. And I graduated as a chiropractor. I had the pleasure of seeing a chiropractor since I was 12 years of age. And he was a functional medicine doctor, wanted to look at the root cause of your pain and any other health issues. So I started practicing that way when I graduated. And then I learned about something called foundational medicine. And in functional medicine, they say they're trying to get at the root cause, but oftentimes practitioners can be very similar to traditional medicine. In traditional medicine, you've got a problem. We're going to do tests and find out why that's going on, and or at least that's what they say. And they'll give you a diagnosis and then a treatment. And then for the life of that problem, we're giving you a pill, a treatment, a whatever. Functional medicine can be much the same way, where, oh, we find a deficiency and we're going to give you a pill. In this case, not a prescription, but nutrients, herbs, things like that. Whereas foundational medicine, that was coined by a friend, another practitioner that I know. And foundational medicine asks the question, why are you deficient? Why do you have that diagnosis? What contributed to that? Because we know that the body is a self-healing, self-regulating system. And if you're like, oh gosh, my body hasn't been self-healing for years. Well, if you cut yourself, do you not bleed? Do you not mount an immune reaction? Do you not close off that wound eventually? So if that still goes on, your body for sure is capable of healing and repairing. So foundational medicine asks those deeper questions. Why is your vitamin D low consistently? And as soon as you get off medicine or supplements, it goes right back. I also added to my toolbox something called Mind, Body, Spirit Release, and this addresses how emotional imprints or emotional blockages may be affecting our health. Done lots of alt training, but what led me to all of this? Well, at 12 years old, I was sick. I had lots of health challenges already. So that's what interested me in health. Now, I mentioned at 12 years old, I started seeing a chiropractor, and that was absolutely wonderful. I changed my mind from being a surgeon and decided I was going to go to chiropractic school. And one of the things that I saw in practice is that those first few patients, those first few years, people responded quicker than what I saw later on in practice. And by the time I was in later in my practice life, from 2008 to 2019, I was a instructor, an associate professor at a chiropractic college, and I kept seeing that students were more brittle. Students came to us already with more conditions, more past injuries from sports and things like that. And I kept seeing that. And by about 2020, I decided that's it. I'm going to go back into full-time practice because my aha moment was I had a former student just a few years out into practice, and he was not yet 30, and he had a heart attack. Also, in the near that time, I had a student who died of colon cancer. And I had more students than I could count, female students, former students who had infertility. And I just thought, my goodness, even these practitioners that know about good movement, good exercise, good sleep, they're getting adjustments to balance their nervous system. Wow, they just keep getting sicker. So that's when I went back into practice. So over the course of this program, Getting the Most Out of Your Care, we are going to cover those things that some foundational things that I wish every patient knew. And I literally mean that every patient, whether you're coming to me for chiropractic care, you're coming to me for soft tissue work, you're coming to me for rehab after an injury, you're coming to me for MBSR treatments, you're coming to see me for detox and functional and foundational medicine. It doesn't matter. Whatever, if you've got a pulse, these are the things I wish you knew about your body. So, some of the key points that we're going to look at are why energy and drainage are key. Okay, I'm going to explain that more later, I promise. And then I'm going to talk to you a bit about when you have chronic pain, what else that might be telling you. It's not necessarily that your spine's a wreck or your joints are a wreck, or if so, why are they? Is it just trauma? Let's look at that. We're also going to talk about the common toxins that we just really can't get away from anymore. I don't care where you live on this planet. And then some options to help your body heal and become more vital and strong. So that's where we're going to go. So the takeaways that I hope you have at this point is if you're here watching this, you're looking for some answers. And I hope as you go through this program that you feel excitement. And if you have gotten to the place where you have lost hope, that you will get some of it back again, because that's how I was several years ago with all the things that I knew. Fortunately, I found foundational medicine and I was able to dig deeper and change my health in ways I never could have imagined. So I'm hoping that for you as well. But as you're going through this, I want you to follow your intuition. It's valuable. And if something resonates with you, lean into it as you go through this program. Learn more, ask questions. You can always message me and I'll give you that information as we go through the program. But listen to your intuition. You know your body better than anyone else. And any of the information that we give, if it resonates, keep it, love it, receive it, use it. If it doesn't resonate at that time for you, put it aside. Don't worry about it. And here's something I want to encourage you. Let's say you've been to other practitioners and you are not feeling well. You know something is not right, but your labs are normal. I've got to tell you, I'll be able to explain why you're sick, but your labs are not yet abnormal. So here we go. I want you to soak things up. I want you to keep and hold on to those things that resonate, or as my husband says, follow peace. Okay? Blessings to you. And so we're going to close this video, and I want you to go ahead and start lesson number 1. Thanks for joining us. Bye-bye.